A lot of times people want to know with their symptoms, do I have a cold? Do I have a flu? Do I possibly have the coronavirus? Or is it just allergies? And it can be hard to tell. But a couple of indicators can kind of help us narrow it down. And we can kind of get a ballpark idea. Of course, we never know for sure unless we go into a doctor. But the first thing that you want to ask yourself is, do I have a fever? And you want to take your temperature. If you do have a fever, you potentially could have the flu, or you potentially could have the coronavirus. Both of those usually have a fever present. If there's no fever present, you can probably rule these two guys out for the most part. The cold almost never has a fever, where the flu almost always has a fever, and the coronavirus almost always has a fever. Okay? However, how do you know if it's a cold or allergies? Well, typically with a cold, you get a sore throat of some sort. Your nose starts to kind of get congested, and you may sneeze, and usually you finish off a cold with coughing. If you go through that period of symptoms, you probably have a cold. Okay? Generally with a cold, you're not too fatigued, you're not too tired, you just have these symptoms. With allergies, sometimes you can get all of these. Some people cough, some people even wheeze a little bit with allergies. Some people sneeze, some people get a mild sore throat, some people get watery eyes, some people get headaches. Allergies can have all sorts of symptoms, but generally speaking, you don't go through this cycle. You generally get one thing and then another thing pops up. Usually allergies are seasonal. Okay, and by the way, allergies are just an overreaction of the immune system. That's what allergies typically are. Okay, now as far as the coronavirus, okay, the symptoms of the coronavirus typically are you get really tired and fatigued, and you have a hard time just walking around. Your breath, you usually are short of breath with the coronavirus, and you get a dry cough. I should add that one to this list. The coronavirus usually has a dry cough. Your chest is usually pretty tight because of that, and you have a fever. Okay? With the flu, it can be very similar, except most of the time with the flu, you don't get shortness of breath. Sometimes you do, but most of the time you don't. But you're tired and you have a fever. Okay? So if you have these symptoms, you usually want to self-isolate yourself, and you want to consider calling your doctor and seeing what your doctor thinks about it.